Good day, and thank you for having me. I'm here to speak with you about the Salmonella outbreak last year related to pet turtles. Salmonella enterica serovar agbeni is one species of Salmonella that has been linked to turtles with shells less than 4 inches, usually purchased as pets. It must be noted that while any turtle may carry Salmonella, it is the turtles with shells less than 4 inches that are more likely to carry the bacteria. The Food and Drug Administration has banned the sale of these turtles in the United States since 1975, but they can still be purchased illegally, mostly through street vendors. Salmonella enterica results in a diarrheal illness. The severity of the illness depends on the affected individual. Most cases result in fever, stomach aches, and diarrhea, mostly gastroenteritis symptoms. They are usually self-limited, lasting a week or less, and do not require medical intervention. In the cases where the individual is a young child, elderly, or immunocompromised, the disease can be more serious and lead to hospitalization or death. Salmonella enterica is transmitted from the turtle through direct contact of the turtle, its habitat, or tank water. If a turtle had contact with an area, a tub or sink for example, and that area was improperly cleaned, the bacteria can be spread indirectly as well. Salmonellosis has an incidence rate of approximately 15.2 per 100,000 people in the United States annually, which is roughly 1.2 million people affected and up to 450 deaths. Fortunately, the outbreak with the turtles in 2017 was on a much smaller scale, nonetheless contributing to the statistics of salmonellosis. The first outbreak was between March and August, which resulted in 37 cases across 13 states. The second outbreak began in late August through November and resulted in a total of 66 cases across 18 states. As you can see, the Northeast and Great Lakes region of the states has the highest case counts. Salmonella is a reportable disease in the United States. Therefore, we relied on reporting from labs, hospitals, and physicians once stools were shown positive for Salmonella. From there, we relied on labs to send the samples to public health labs for serotyping. Serotyping is a time-intensive process and can take upwards of 10 days to happen. The serotyping from the case is compared to other serotypes already in the database. In this case, there was a match to agbeni that had been linked to pet turtles years earlier. Ultimately, from the time the first person is infected until we knew we had an outbreak on our hands was anywhere from 2 to 4 weeks later. Armed with the knowledge that this is a potential outbreak related to small turtles, agents were sent into the field to contact the recently ill cases reported. They were given questionnaires to assess how severe the illness was, what they had come in contact with, and if anyone else close to them had gotten sick as well. Assessing the ill individuals as well as close contacts, we were able to get a better idea of how many people were affected. Interviews revealed that about 40% affected had come into direct contact with turtles, and 60% of those remembered them having shells less than 4 inches. We were also able to gather information from some individuals as to where they came in contact with the turtles, be it a street vendor, pet store, market, or other places. Reports of where the turtles were purchased or contacted were passed on to appropriate authorities to investigate further and remove the source of infection. While many laws exist to ban the sale of these turtles, there are of course people breaking the law. As health professionals, asking families about their pets, current and planned, is important, especially if you know there are young or elderly individuals in the household. Finally, the best advice you can give to patients is to always wash their hands after touching animals, as you are well aware that simple act can prevent so many unnecessary illnesses. Thank you.